Welcome everyone. It's a pleasure to have you with us here at Panorama Scan. Our mission is to bridge advanced imaging technologies with practical clinical workflows. Whether you're a seasoned specialist or just starting to explore the depth of fetal echocardiography, we are here to support your growth with cutting-edge content, real clinical cases, and a clear, structured approach. Today's mini course focuses on a powerful advancement in fetal cardiac imaging, 5D heart. We will explore how this automated technique is reshaping the assessment of fetal heart, bringing efficiency, consistency, and diagnostic clarity into one intelligent workflow. Let's dive into this evolving world of volumetric imaging and see how technologies like STIC and 5D Heart can transform the way we approach fetal echocardiography. Let's begin by outlining the key objectives of this advanced mini course. First, we will gain a solid understanding of volumetric fetal echocardiography. This means stepping beyond the limitation of 2D imaging and exploring how 3D and 4D datasets can be used to evaluate fetal cardiac anatomy dynamically in motion and with a spatial context. Next, we will cover the landmarking and processing of normal cardiac anatomy using the 5D Heart system. We will walk you through how automated tools can help clinicians accurately identify essential structures from chambers and valves to outflow tracts, streamlining both diagnosis and documentation. Finally, we will address a crucial aspect, the challenges of volume acquisition. Capturing high-quality cardiac volumes is a skill in itself. We will look at how to minimize common issues like motion artifacts, poor fetal positioning, or unfavorable inclination angles, and how to optimize settings for the most reliable results. The goal of this mini course is to empower you with practical insights that elevate your confidence and precision when using volumetric techniques in fetal echocardiography. One of the primary challenges when applying 4D ultrasound to a fetal heart is dealing with cardiac motion. Unlike static organs, the fetal heart constantly moves, making it difficult to capture all the necessary frames of a dynamic image sequence. Without a method to synchronize these frames across the cardiac cycle, uh, acquiring smooth, accurate representations becomes almost impossible. This is where STIC or spatiotemporal image correlation comes into play. STIC is a revolutionary technology that captures a full 4D dataset of the fetal heart through a single slow volume sweep. What's impressive here is that it doesn't require continuous scanning, but instead gathers a series of frames that are temporally correlated to simulate a complete cardiac cycle. This result uh, the result is a stick loop, which provides a seamless dynamic view of the fetal heart in motion. By synchronizing the frames across the cycle, STIC eliminates much of the guesswork and variability associated with traditional 4D ultrasound, giving us a true representations of the heart's activity. STIC technology has fundamentally transformed how we assess the fetal heart by overcoming several critical limitations in traditional 4D imaging. Let's break down how this innovation works. First, we have a virtual cardiac gating. This intelligent system allows us to estimate the fetal heart rate and align the captured frames in such a way that they simulate a real-time beat-to-beat cardiac cycle without the need for ECG synchronization. This makes the process more streamlined and less dependent on external signals. all while maintaining high temporal accuracy. Next, there is the built-in motion artifact checker. One of the biggest hurdles in volumetric imaging is ensuring that the captured data is free of motion artifacts, especially with a moving target like the fetal heart. STIC technology comes equipped with the integrated quality control tool that automatically checks the dataset for any motion inconsistencies, ensuring that only the highest quality volumes are processed. Finally, each stick loop captures a comprehensive 4D dataset. This loop includes all the voxel information within the region of interest, providing us with a high-resolution manipulable dataset. This means that once the dataset is acquired, it is ready for multiplanar reconstruction, uh, advanced rendering, and post-processing, giving us the flexibility to examine the heart, the fetal heart, from multiple angles and perspectives. To truly appreciate the power of STIC, it's important to understand how the system works behind the scenes. The volume acquired through STIC isn't a single static image. It is built from thousands of individual 2D frames, typically around 5,000 frames captured within the region of interest. Here is what happens in the background. Uh, Extracting heart rate from motion patterns. STIC begins by analyzing the periodic movement of key cardiac structures. This allows the system to estimate the fetal heart rate based purely on motion pattern observed in the dataset. No external gating mechanism like ECG is needed. This is a significant advantage as it simplifies the acquisition process while maintaining accuracy. Generating a virtual cardiac cycle. Once the frames are captured, STIC uses frame correlation to assemble a single synthetic cardiac cycle. Essentially, each frame in this loop is created by averaging and layering multiple corresponding frames to reduce noise and enhance temporal resolution. This process smooths out inconsistencies and ensures a dynamic, high-quality representation of the heart emotion, uh, delivering versatile volume data. The final product is a voxel-based dataset, which offers flexibility in how we analyze the heart. This dataset can be rendered in a variety of display modes, whether you need multiplanar, tomographic, surface rendering, rendered, or even scenarios. This versatility allows for detailed exploration of the heart from multiple angles, depending on the clinical question at hand. Now we are getting into the heart of the clinical application of STIC technology. In this slide, we are showcasing a multiplanar reconstruction of a 20-week fetal heart acquired by STIC. The dataset has been reformatted into three orthogonal planes, A, B, and C, with plane A showing the axial plane, the sagittal plane in plane C, and the coronal plane in plane C. These three synchronized planes allow for comprehensive, detailed anatomical evaluation from multiple perspectives, with the ability to navigate through the cardiac volume, voxel by voxel. We can achieve an incredible precise assessment of the heart structure. From here, we can accurately identify critical components such as the cardiac chambers, great vessels, and septal structures, all of which are clearly visible in a static yet dynamic view. This feature of STIC technology forms the bedrock for more advanced automated tools like 5D Heart and 5D Heart color tools that further enhances our diagnostic capabilities by streamlining the identification process. This multiplanar approach mm, gives us a comprehensive multiple angle view of the fetal heart, which is invaluable for both routine assessment and more complex evaluations. In this slide, we take the same STIC acquired data set one step further by applying surface rendering in thick slice mode. The result is a beautifully enhanced and dynamic full chamber view of the fetal heart at 20 weeks. This rendering method offers several technical and clinical advantages. First, it amplifies depth perception, giving us a more three-dimensional understanding of the cortic anatomy. Second, by averaging data across a thicker voxel slice, it smooths out noise and highlights structural continuity. Third, and most importantly, it allows for clearer visualization of key features such as endocardial borders, interventricular and interatrial septa, and the motion of cardiac valves, of course, all in real time. What we can achieve is not just another image, it is cinematic quality volumetric rendering that serves as a powerful tool for diagnosis, education, and even professional peer review. This level of visual clarity and anatomical context elevates our assessment capability, moving us from conventional sonography into the realm of next generation echocardiographic imaging. The same data set, new perspective. Here we applied inversion mode to the previously acquired stick volume, an advanced rendering technique that inverts grayscale values to highlight anechoic or fluid-filled spaces within the fetal heart. This demonstration gives us a beautifully sculptural representation of the fluid phase, allowing blood-filled cardiac chambers and vessels to appear as bright 3D positive structures against a dark background. What does this unlock for us? Gives us a crisp visualization of intracardiac spaces, including atria, ventricles, and valves, a seamless flow continuum from the four chambers through the outflow tracts, and in a well-timed loops, visually striking bifurcation of the pulmonary artery or the aortic arch depending on the phase and orientation. This view isn't just elegant, it's clinically powerful. It enhances our ability to assess lumen continuity, valve motion, and even the spatial relationships of flow pathways with clarity that's hard to achieve in standard grayscale or surface renders. Inversion mode takes that what we know and makes it visceral, bringing the physiology to life in every frame. Now we step into a new dimension of volume analysis, tomographic ultrasound imaging or TOI. Using the same STIC acquired fetal heart volume, TOI allows us to reformat the dataset into 16 evenly spaced parallel slices through the fetal thorax. This gives us a panoramic look at cardiac anatomy in sequential frames, almost like flipping through a high-resolution anatomical flipbook. Why is this powerful? we gain simultaneous visualization of multiple cardiac planes from base to apex, captured in a single static volume. It allows for direct comparison across adjacent slices, uh, making it easier to catch subtle asymmetries or deviations in structures. The technique highlights the parallel orientation of cardiac anatomy, offering an exceptional tool for both teaching and advanced diagnostics. Think of it as a CT style display, but purely ultrasound, no radiation, and full solution. Uh, TOI makes fetal cardiac assessment more accessible, more intuitive, and more precise, all while leveraging the strengths of real-time volumetric imaging. Right, automation is cool, but manual skills still matter, especially when you are diving deep into a stick volume. Uh, Here we are navigating using plane B, that's your longitudinal or coronal view as the reference frame to explore the axial anatomy of the fetal heart. What makes this slick? It's the real-time reference dot. As we move it in plane B, it marks the same spot across the orthogonal planes, giving you instant spatial orientation and anatomical GPS. This isn't just about looking around, it's about pinpointing key structural relationships, manually confirming standard cardiac views, and just teaching spatial anatomy like a pro. This technique blends clinical expertise with spatial intuition, and 3D, 4D, and 5D imaging give you the playground to master it. Uh, Welcome to the manual mode. So any fine rotation or uh, slicing, or just the fine tune of uh, 5-chamber view here in the axial plane when we moved the reference point here. As you can see, we are shifting from the 5-chamber view into the left ventricular outflow tract with a very nice short axis view here in the B plane. So let's explore the power of automation with Sono-VCAD Heart, a groundbreaking tool from GE that transforms how we interact with volumetric cardiac datasets. What we're seeing here is more than just a 3D volume, it's the intelligent alignment and automated generation of diagnostic planes powered by GE's proprietary software. Here's the process. First, we align the fetal heart and spine across three orthogonal reference planes, plane A, B, and C. This spatial orientation is critical for anatomical accuracy. Once aligned, the software automatically reconstructs seven standard diagnostic planes, capturing the most clinically relevant views of the fetal heart. This automation does more than save time. It also elevates diagnostic precision, especially in busy clinical environments or in centers training junior staff. The key benefits is a consistent, reproducible view that reduce operator dependency, streamlined cardiac assessments that facilitate early detection of anomalies, an ideal platform for both routine screening and high-level diagnostics. When paired with high-quality stick volumes, Sono-VCAD Heart delivers a perfect fusion of speed and accuracy, allowing clinicians to focus less on mechanics and more on meaningful interpretation. Sometimes a combination of manual navigation to the acquired plane using Sono-VCAD Heart. But yet, practice makes perfect. The more optimal the volume acquisition is, the more expertise you will have and acquire in the alignment system, you will get the perfect results from Sono-VCAD Heart. Let's talk about fine, and now not the I am fine, we say, when we are clearly not. This fine stands for Fetal Intelligent Navigation Echocardiography, a true game changer in the fetal heart imaging, developed by some brilliant minds at the BRP and Med platforms. Fine uses smart algorithms to automatically extract standard echocardiographic views from single stick volume. That's right, no need to hunt through the dataset manually. You will see Fine implemented under the two big names, SonoCubic Fine, the original platform, and 5D Hot, Samsung's own flavor embedded in their WS80 Elite WS80A Elite systems. What does this bring to table? It offers a seamless, semi-automated cardiac evaluation, high reproducibility and diagnostic accuracy, a massive drop in operator dependence and time spent per case. Fine is a moment is the moment AI stopped just assisting and starting transforming prenatal echocardiography. This isn't just automation, it's intelligent navigation with real clinical impact. Now let's answer a critical question. Why 5D Heart? What makes this technology more than just a new gadget in our imaging arsenal? The short answer, it was designed to solve real-world problems that clinicians face daily, especially those who are still mastering the complexity of fetal cardiac evaluation. 5D Heart is built to empower users at all experience levels by delivering standardized, high-quality diagnostic output planes with minimal effort. Here is what it brings to the table. 9 essential cardiac planes automatically extracted from single stick volume, aligning with the gold standard guidelines from the AIUM. High reproducibility and reliability, ensuring diagnostic consistency across different patients and operators. Confidence in your findings, even in difficult cases or when anatomical windows are suboptimal. Time efficiency. What what used to take 10 to 15 minutes of manual manipulation can now be achieved in under 2 minutes. Workflow optimization, which is invaluable in high volume clinics, of course. And crucially, the dramatically reduced learning curve, enabling clinicians to deliver expert level assessments much earlier in their training journey. In essence, 5D Heart is not just an imaging tool, it's a precision engine. It enables smarter scanning, faster reporting, and better outcomes without sacrificing the human skills behind the machine. Let's bring theory into the real world. What you're seeing here is a real clinical case from Panorama Scan archives. Uh, Dated back to 2018. It's the same benchmark STIC volume we previously analyzed, but now we are using the 5D Heart automated approach with just a few landmark points identified. 5D Heart automatically generated all 9 diagnostic planes as recommended by the AIUM, and just like that, no labor intensive manipulation, no prolonged trial and error. The full spectrum of cardiac anatomy is laid out for review. This is not a simulated demo or actually picked dataset. This is a real world fetal echocardiography performed in an actual clinical workflow, and it's a powerful demonstration of how automation can enhance consistency and efficiency without sacrificing diagnostic integrity. Uh, it's a reminder that technology isn't here to replace expertise. It's here to amplify it, making our insights more accessible, more standardized, and more scalable across all levels of experience. Let's take a closer look at what makes 5D Heart truly next gen. Uh, this short video clip walks you through the core logic of how the technology works and why it's such a leap forward compared to older rendering modalities like TOI. First, you'll notice that instead of manually scrolling through the slices, our toggling plans, 5D Heart intelligently navigates the volume. It detects key anatomical landmarks, aligns them, and instantly generates up to 9 diagnostic planes, giving you a comprehensive cardiac map in just seconds. It's like having an expert operator inside the machine doing the hard part for you, but with clinical precision. This video also compares the semi-automated approach with the traditional manual workflow. The difference, it's night and day, not just in terms of speed and ease, but also in reproducibility and diagnostic confidence. Especially important when you are managing high-stakes cardiac assessments or teaching complex cases. 5D Heart is more than just a clever software. It's a diagnostic partner uh, built to reduce variability, streamline workflow, and support confident, consistent decision making at any experience level. As we wrap up this lecture, it's important to spotlight the core information uh, clinicians aim to extract when evaluating the fetal heart, beginning with anatomy. Using 5D Heart, we are able to perform a comprehensive structural assessment across multiple standardized planes. This include uh, chambers where assessing morphology, relative size, and symmetry are essential. The outflow tracts confirming their continuity, crossover, and orientation, cardiac valves, visualizing their form, motion, and septal alignment, great vessels following their course, branching patterns, and relationship to other cardiac structures. Septal structures evaluating the atrial and ventricular septae, as well as the positioning and patency of the foramen valve. What gives 5D Heart a major edge is its use of the 9 diagnostic planes, aligning with the American Institute of Ultrasound and Medicine standards that exceeds the 6 planes approach recommended by the AIUM, providing more comprehensive anatomical coverage and boosting diagnostic confidence, especially in complex or supracortic anomalies. Its structural map made smarter, faster, and more made it smarter, faster, and more accessible. Let's now turn our focus to the functional side of fetal cardiac assessment, because structural alone doesn't tell the whole story. With 5D Heart, we can observe chamber motion, capturing real-time dynamics of both atrial and ventricular walls to evaluate contractility, rhythm, and coordination. Valve function, analyzing leaflet mobility and closure throughout the cardiac cycle to assess valve competence and flow continuity. These dynamic assessments give us vital clues about hemodynamic efficiency and functional integrity, helping detect conditions that may not be obvious on structural analysis alone. By uniting both anatomical precision and physiological insight, 5D Heart doesn't just visualize the fetal heart, it elevates our entire approach to prenatal cardiac evaluation, making it more comprehensive, reproducible, and clinically meaningful. Let's wrap up by zooming out and taking in the full view of what we've just explored. We started with the fundamentals of volumetric fetal echocardiography, then followed the journey from STIC acquired loops, enabling reconstruction of a virtual cardiac cycle to automated and semi-automated solutions that are reshaping how we interpret fetal heart anatomy and function. We saw how the technology evolved from manual multiplanar displays to tomographic ultrasound imaging, and finally the next gen tools, 5D Heart and Sono-VCAD Heart. So why does this matter? Because 5D Heart isn't just another imaging add-on, it's a game changer. It automates the generation of the 9 diagnostic planes in line with the AIUM guidelines. It offers a short learning curve, empowering both seasoned experts and early listeners. It ensures high reproducibility and diagnostic confidence, even in challenging cases. And it radically boosts workflow efficiency, especially crucial in high volume fetal medicine settings. The key takeaway, 5 Heart is a clinical revolution, bringing together intelligent automation and precision imaging to push fetal echocardiography into a new, smarter era. Thanks for staying with us through this journey. The future of fetal heart imaging is already here. Thank you for joining me today in this deep dive into the future of fetal cardiac imaging with 5D Heart. I hope you now have a better understanding of how this innovative technology can transform clinical practice, increase diagnostic confidence, and streamline workflows in fetal echocardiography. Um, if you have any questions or would like further clarification on any of the topics we covered today, feel free to reach out. Let's continue pushing the boundaries of fetal medicine together. Uh, Thank you for your time. Wishing you all the best in your clinical practice and research. Uh, and I look forward to connecting with you again soon.